watching Let's Chat.
Dr. Taylor Rowlett joining us this morning from CHI Memorial, and we're talking about breast health and breast cancer, and there's a lot we know about it, and there's a lot we don't. Dr. Rowlett, good morning.
Yeah, thank you.
We're going to begin talking about 3D mammography, which has just made leaps and bounds technology-wise over the past few years.
Sure. Yeah, we've had 2D mammography for a long time, and now just in recent years we've started doing 3D mammography as well.
How does that make your job more accurate and easier for you?
Sure. So from the radiologist perspective, there's a couple of benefits.
Right.
We are able to unmask breast cancers that we otherwise wouldn't see on regular 2D mammography, meaning if you have a breast that has a lot of fibroglandular tissue in it, it's sort of like a sea of white, and the cancer is also white, and I can't find it in there very easily. But with a 3D mammography, I'm able to actually pick it out of the fibroglandular tissue and see it better.
Because the breast density obviously has a lot to do with the detectability, and I would assume the treatment of this.
Right. Yeah, the detectability is the major factor. So if you think about, most women nowadays will get a letter in the mail telling them that their mammogram was normal, come back in a year. But in Tennessee, women that have dense breast tissue are actually going to get a letter that says that they have dense breast tissue, and they're going to be left wondering what they should do about it. And so there's 4 categories of breast density. And you have women that are extremely dense, where they have more than 75% fibroglandular tissue in their breast. And then you have women on the other end of the spectrum that have fatty replaced breast tissue. And so that makes a huge difference in detectability for me. Because if I'm looking at a sea of gray in a fatty replaced breast, and I see a little white nodule in it, I can easily pick out that breast cancer. But if I'm looking at a very white breast, an extremely dense breast, then I have a really hard time finding a small little cancer in there.
Explain to me a little bit about the breast density notification laws. I understand there's one of these on the floor of the Georgia House. Is that correct?
Yes, I believe so. So in Tennessee, it's been a law for several years now that any woman that has dense breast tissue, either one of those 2 upper quartiles of breast density, they'll get notified and told about it. And in Georgia, this is becoming a law potentially this year. The House, I believe, in February actually passed it, and now it's before the Senate in Georgia.
And as good as the 3D screening is there something that you can use as a doctor and a healthcare professional to help supplement that?
Yes. So we have quite a few supplemental options now for screening for breast cancer. So the first line, I think, is breast tomosynthesis. 1, because it's readily available. 2, because the patient doesn't have to do anything extra. They just show up for their mammogram and they can have it done. They don't need an extra appointment. Right. But if you need to go beyond that, especially if you're like a high-risk patient, then breast MRI is the best option for screening for breast cancer. It gives us the most specificity and the highest detectability rate, but that comes with a much added cost compared to just tomosynthesis, which is relatively low cost.
But the clinical benefits of this, when you combine what you're doing, I mean, obviously your expertise and your training along with the 3D mammography and the, I can't even begin to pronounce, tell me this word again.
Tomosynthesis?
Tomosynthesis.
Yes.
It's got to make it clinically a little more advantageous for women to go where all of these are available under one roof and under the umbrella of one appointment.
Sure. And so fortunately at the MaryEllen Locher Breast Center, both downtown and at our Hickson campus, we are able to offer 2D mammography with the 3D mammo tomosynthesis, breast ultrasound, and then downtown we have a breast MRI unit as well. So
how often should women be screened like this?
So women should get an annual mammogram every year starting at age 40.
Age 40.
Right. And women that have dense breast tissue should consider tomosynthesis every time they come in.
Right.
But we're also seeing that there's added benefit for tomosynthesis for all breast density categories.
Right.
So even women that are fatty replaced or scattered fibroglandular tissue, they should consider it as well.
Dr. Taylor Rowlett, we look forward to having you join us coming up here in future weeks. If you would like to find out more about this and some of the other exciting health developments, check out the website of CHI Memorial. They are easy to find. It is chimemorial.org.